Hi, I am Dr. Jocelyn. Brand new research published just weeks ago is going to make you question everything you've been told about blood pressure. For decades, the message has been simple and absolute. The perfect number is 120/80. That's the goal. That's what everyone should aim for. Lower is better. Get it down. Keep pushing it down. But this new research reveals something shocking. For older adults, especially those over 65, aiming for 120/80 may actually be dangerous. It may be increasing falls, it may be triggering strokes, it may even be contributing to death. You've probably been told your entire life that lower is always safer, that if your numbers aren't at 120/80, something is wrong. But for seniors, the body does not work the same way it did at 40. The blood vessels are different, the brain responds differently, medications behave differently. And when we apply the same target to a 75-year-old that we use for a 45-year-old, the results can be devastating. I'm not going to give you the perfect number yet. Not because I want to tease you, but because if I tell you right now, some of you will write it down and stop listening. And that would be dangerous. You need to understand why this number is different for seniors. You need to understand what happens inside your body when blood pressure becomes too low at your age. You need the full picture before you decide what is right for you. Because for older adults, lower is not always better. Sometimes lower is deadly. Before I explain anything else, I want you to think about this. Have you ever felt dizzy when you stood up? That brief, spinning sensation. That moment where you have to grab a chair or wall. Most people brush it off. It's just age. I stood up too fast. But for seniors, that feeling can be a warning sign. It can mean your blood pressure is dropping too low when you change positions. And that drop can be the difference between staying independent and suffering a life-changing fall. Comment your current blood pressure and your age. Just the numbers and your age. I need you to start paying attention to what your body is doing. Let me tell you about Eleanor, because her story changes everything. Eleanor was 78 years old when I first learned about her case. She had been diagnosed with high blood pressure 10 years earlier. At the time, her reading was 152/88. Her doctor started her on medication. 2 months later, her pressure dropped to 138/82. Her doctor was pleased, but said, "We need to get you to 120/80. That's the goal." So the dose was increased. 2 months later, her pressure was 128/76. Better, but still not perfect. A second medication was added. "We really want you at that ideal number," he told her. "That's where you'll be safest." Eleanor trusted him. She took her pills every day. She checked her pressure at home. 2 months later, her reading was 122/78. Her doctor smiled. "Perfect. This is exactly where we want you." At first, Eleanor felt fine, maybe a little tired, but she was 78. Tired felt normal. Then something changed. Every time she stood up, the room spun, just for a moment. A wave of dizziness. She had to hold on to something until it passed. She mentioned it at her next visit. "That's just age," she was told. "Stand up slowly." So she did, but the dizziness didn't stop. And that was the beginning of the cascade that would change her life forever. Eleanor began to move differently. Every time she rose from a chair, every time she got out of bed, there was a pause, a hesitation. Her body remembered that spinning feeling, even when it didn't happen. She became careful, then cautious, then afraid. Her daughter noticed it first. "Mom, you're moving like you're scared," she said. "What's wrong?" Eleanor explained the dizziness. Her daughter urged her to call the doctor again. Eleanor did. The nurse returned the call with a message. "The doctor says as long as your blood pressure is good, this is probably just age. Make sure you're drinking enough water." So Eleanor tried to ignore it. She told herself this was normal, that this was what getting older felt like. But the dizziness kept coming. One morning, 3 months after her blood pressure had been lowered to perfect, Eleanor woke up and needed to use the bathroom. She sat up in bed, swung her legs over the side, stood. The room exploded into motion. Her knees buckled. She reached for the nightstand but missed. She fell hard, her right hip striking the corner of the furniture before she hit the floor. The pain was immediate and unbearable. She tried to move and couldn't. Her husband heard the crash and ran in. He found her on the floor, crying, unable to move her leg. He called 911. In the ambulance, her blood pressure was checked while she lay flat. 118/74. That looked fine. Then they checked it sitting up. 94/62. Then standing. 82/54. Her blood pressure was collapsing when she changed positions. At the hospital, X-rays showed a fractured hip, completely broken. She needed surgery, hip replacement. At 78, surgery carries real risk. Infection, blood clots, pneumonia, complications from anesthesia. But there was no alternative. Without surgery, she would never walk again. The operation went well, but recovery did not. Eleanor spent a week in the hospital, then 3 weeks in a rehabilitation facility. Physical therapy twice a day. Pain. Exhaustion. Before the fall, she had lived independently. She cooked, she cleaned, she went out. Now she needed help with everything. She felt like she had aged 20 years overnight. When she finally went home, she was not the same woman. She was afraid. Afraid to walk without a walker. Afraid to move too fast. Afraid to be alone. Her daughter stayed with her. Her world shrank. Before the fall, Eleanor went to the grocery store, to church, to visit friends. Now she barely left the house. 6 months later, Eleanor developed pneumonia. She had been sitting and lying down so much, afraid to move, that fluid built up in her lungs. At 79, with reduced mobility, pneumonia is dangerous. She was hospitalized, given antibiotics, oxygen. Her body could not clear the infection. She died 3 days later. Her daughter was devastated and angry. "Mom was fine before they lowered her blood pressure," she said. "She was active, independent, happy. Then they got her to 120/80, and she started falling. That fall started everything. All because her blood pressure became too low for her age, but she had been told that 120/80 was perfect. So how can perfect kill someone? That is the question, and the answer is simple and unsettling. 120/80 is not perfect for everyone, especially not for seniors. For older adults, especially those over 65 and over 70, pushing blood pressure down to 120/80 can be dangerous. It can lead to exactly what happened to Eleanor: dizziness, falls, fractures, loss of independence, and sometimes death. If you ever feel lightheaded when you stand, that is not something to ignore. Comment "dizzy" if this happens to you. It is a critical warning sign that your blood pressure may be too low for your age. Eleanor's story should scare you, but it should also make you angry. Her death was preventable. If her blood pressure target had been higher, if her medications had been adjusted, she would likely still be alive. She would still be walking, still independent. But her care followed old thinking. One number for everyone. The truth is, the body changes with age. As you get older, your arteries become stiffer. They lose their flexibility. In a younger body, blood vessels expand and contract easily. They absorb pressure and keep blood flowing smoothly, even when you stand up. In an older body, stiff arteries cannot adjust as quickly. That means your brain depends on slightly higher pressure to get the blood it needs. In a 40-year-old, 120/80 is usually enough to keep blood flowing to the brain when standing. In a 75-year-old, that same number may not be enough. When you stand, gravity pulls blood downward. If your vessels cannot respond quickly, pressure drops. The brain gets less blood. You feel dizzy. Your vision dims. Your balance disappears. That is how falls begin. There is another change that comes with age. The sensors in your blood vessels that detect pressure shifts become slower. In younger people, these sensors react instantly. Stand up, and your heart speeds up, your vessels tighten, and pressure stays stable. In older adults, that response is delayed. If your baseline pressure is already low, that delay becomes dangerous. Add medications to this picture, and the risk grows. Older bodies process drugs more slowly. The same dose that feels gentle to a 50-year-old can be powerful in an 80-year-old. Medication builds up. The pressure drops too far, and the body cannot compensate. The risks also change with age. For younger adults, high blood pressure causes damage over decades. Heart disease, stroke, kidney failure. Lowering pressure aggressively makes sense. For seniors, the immediate danger of low blood pressure often outweighs the long-term danger of moderate elevation. A fall can end a life in months. A pressure of 140 may never cause harm. This is why one number does not fit everyone. Large studies in recent years have begun to reveal this. When researchers followed real adults over 75, not ideal patients but real people with frailty, diabetes, past strokes, they found something surprising. Those with systolic pressure between 130 and 140 lived longer than those below 120. The lowest pressures were linked to more falls, more kidney injury, and higher death rates. The group with very high pressure had more strokes, but the group in the middle did best. That middle range became the sweet spot. Not too high, not too low. And here is what matters most. The right number is not the same for everyone. A healthy 68-year-old may do well near 125. A frail 82-year-old may be safest near 145. Two people of the same age may need completely different targets based on strength, medical conditions, and how their body responds. This is not about chasing perfection. It is about staying upright, staying clear-headed, staying independent. Because for seniors, the goal is not just living longer, it is living well. Now let's look at real-life examples to understand why individualized blood pressure targets matter. Harold was 72, active, healthy, no major medical conditions. His blood pressure was 146/88. His doctor wanted him at 120/80, so he started medication. After 2 months, Harold's pressure dropped to 124/78. But Harold felt awful. He was dizzy, fatigued, couldn't focus. His quality of life dropped dramatically. After reviewing his case, we realized that for someone like Harold, 146/88 wasn't dangerous. The medications were causing more harm than good. We reduced his medication, let his pressure settle at 136/82. Immediately, Harold felt better. Energy returned. Dizziness disappeared. He could think clearly. Even though 136/82 is higher than traditional targets, it was safe for him and allowed him to live well. Then there's Margaret, also 72, same age as Harold, but very different health profile. She had diabetes, a previous heart attack, and reduced kidney function. Her blood pressure was 146/88 as well. For Margaret, that pressure was risky. We needed to lower it, but aggressively pushing to 120/80 would have been dangerous. Her body wouldn't tolerate it. We targeted 130/80, carefully adjusting medications. Margaret tolerated it well. No dizziness, no fatigue, and her risk of another heart attack or stroke was reduced. Two people, same age, same initial blood pressure, completely different targets. That's why one-size-fits-all guidelines don't work for seniors. You need to consider age, health conditions, frailty, and medication sensitivity. Even very old adults sometimes need higher targets. Ruth was 83, frail, with diabetes, heart failure, and chronic kidney disease. Her blood pressure was 168/92. Her doctor wanted to lower it aggressively. But in Ruth's case, lowering pressure significantly could have caused falls, fractures, or worse. We left her at 160/90. Not textbook perfect, but safest for her. Ruth stayed stable, no hospitalizations, her quality of life maintained. She remained independent. 5 years later, she was still alive, still living at home, showing that sometimes higher pressure is safer than aiming for perfection. Healthy seniors still often need higher targets than younger adults. William, 70, healthy, active, loved golf, no significant medical issues. His pressure was 142/84. His doctor wanted 120/80, but William felt great at his current numbers. We agreed to maintain it. The risk from 142/84 was minimal, and the benefit from lowering it would have been small. More importantly, lowering aggressively could have caused dizziness or falls. William stayed active, playing golf, traveling, living independently. For seniors, blood pressure management isn't just a number. It's about the whole person. Functional status, quality of life, other medical conditions, fall risk, and personal preferences matter more than blindly chasing 120/80. Treating the patient, not the number, is what keeps older adults safe, independent, and thriving. If you felt like your doctor only wants to hit a target without considering how you feel, comment, "Treating me, not number." I want to see how many people have experienced this. Understanding this distinction can prevent unnecessary suffering and preserve independence in older age. The middle ground is where safety and quality of life intersect. Too low can be as dangerous as too high. The goal for older adults is to find the sweet spot. Enough pressure to keep blood flowing to the brain and organs, but not so high that it increases stroke risk. This balance is the key to living well while managing blood pressure.